Hello all. Today we'll be discussing about the fundamentals of modern day mechanical ventilation. So this is a modern day mechanical ventilator. This is also called as positive pressure ventilator. So let us begin with how to start this ventilator. Okay. So here are the tubings. So this black color tube is medical air tube, and this white color tube is oxygen tube. So these two tubes are connected to the ports. So here is the oxygen port, which comes from a central oxygen supply, and here is the medical air port, which comes from central medical air supply. So we have to connect it by holding it properly. Here is the shape square, so it fits here in this square port, and we have to apply some pressure. A small hiss sound will come, which confirms the proper fitting of the tube. And same thing, here is a hexagonal shape, and same method again, a hissing sound will be there, which confirms the proper fixing of these two ports. Once these two ports are fixed, we have to switch on the uh, power cord. Here is the power cord connection from here, so it will be power line. So then here is the button to switch on and switch off, and a long beep sound will be heard. This is how the ventilator switches on. These are the animated images of adult male and adult female, and this is the animation of a baby. So which means this ventilator is suitable for both adults and pediatric cases. So this is the basic layout. Initially it starts from standby status. So to start ventilation, we have to press this icon and then to continue this. So the ventilation begins. So initially, before we connect to the patient, we have to do a system checkup. That is done by this artificial lung, or we call it as test lung. Okay, and this is the test lung. I'll detach and show. This is the test lung. Okay, and again, I'll detach one more tube. This is called as catheter mount. And one more disconnection I can do is the HME filter. So this is the monitor of the ventilator, where there will be a layout displaying the parameters from patient, and the desired parameters which we will set or the treating doctor will set. So grossly it is divided this way. This is called as set parameters. This line is called as set parameters, where we will choose the ventilator mode and other settings such as FiO2, tidal volume, respiratory rate, inspiration to expiration ratio, PEEP, and Pmax. Okay, so let us have a small discussion on this in detail. We will be discussing about the modes and parameters in the next video, which we will be doing very soon. The modes are classified into um, two categories. One is volume control and another one is pressure control. So here VC stands for volume controlled ventilation. A bar C is assist control of volume controlled ventilation. Okay. Next, here we will be having pressure control. SIMV. PC stands for pressure control, and the same mode will be in VC also. VC means volume control. SIMV VC and SIMV PC. This is the gross categorization of the modes. So we go with AC, VC, and coming to the parameters. This is FiO2, the fraction of inspired oxygen. So tidal volume, VT tidal volume. Tidal volume is the amount of air which we want to push into the patient lungs. So this we can increase and decrease using this knob. This is the rate. Rate means the number of breaths per minute which we want to give to the patients through the ventilator. And inspiration, I is to is inspiration is to expiration ratio. So the time of inspiration and the time of expiration. So it will be set in the ratio. So ideally inspiration will be lesser than the expiration, and again it will be discussed in detail in the upcoming videos. So this is the P, positive end expiratory pressure. So and this is the P max.